I'm Dr. Bill Adams, and you're watching the Plastic Surgery Channel. Joining me now today via webcam is Dr. Steve Teitelbaum from Santa Monica, California. Steve, thanks a lot for taking time out of your busy day to share some thoughts with us.
Hey, Bill. Thanks for having me.
So, Steve, I wanted to ask you about something that has come up recently, most notably in a New York Times article last week about this whole topic of awake breast augmentation, where patients are being operated on in a doctor's office under local anesthesia, and it's being touted as an alternative or even maybe a better alternative for breast augmentation. What do you say about that?
I'm sorry that we're even having to talk about it. It kind of reminds me when there's an act of terrorism and the news media feels compelled, because everyone wants to know, why did these guys blow up this thing, that they have to go into the issues of the terrorists, which of course we shouldn't even be discussing something a terrorist thinks about. And similarly here, it was in the New York Times. We have to respond to it, but this is something that should have never made it to the New York Times. We shouldn't be wasting our breath on it, because the more we talk about it, the more people are talking about it. So what happened was a group of doctors with no access to an operating room figured out that they could give some local anesthetic and they would be able to do a whole surgery in an exam room. It's ridiculous. So the whole point that they're touting, though, is this business about it being awake and that the patient can pick the size. Well, Bill, as you know, you're the one who wrote the key paper. The best time to pick an implant size is before surgery. You can do precise, exact measurements and know that you have an implant that perfectly fills that patient's breast, neither stuffing it and making it fake nor underfilling it. The time to do that is not during surgery, where there's air around it and fluid and swelling, and trying to sit a patient up to see how it looks is totally inaccurate. And then asking a patient who's asleep and given medicine, and the medicine that impairs some of their judgment, asking them what they want, well, that's not ethical at all to ask them to give judgment at that time. So I'm really disappointed that we're talking about it.
I read that article, and to me, it was regressing to the 1970s. So it's not that we want our patients to be asleep. We found that our patients are more comfortable being asleep. And there's a fallacy of believing that you're going to wake up the patient at the end of the case and say, do you like them? Are they right? I mean, think about going out to a party and having a bunch of martinis, and then think of what your judgment is like. You can't drive at that point in time. You can't sign consents at that point in time. So why do you think that you actually can judge how your body looks?
Well, I think that the question is, what is safety? And we all know that most breast augmentation is done very safely, obviously, and effectively under general anesthesia. This is breast surgery that's done by quite experienced surgeons. As we know, the risk of general anesthesia in a healthy patient is significantly less than the risk of driving to the grocery store. So I think the first idea or concept that it's somehow safer to do it under local is really probably false. Secondly, I'd say that surgery under local anesthesia is, if anything, much more difficult than surgery under general anesthesia, and consequently, one would want an extremely experienced surgeon to consider, if one was going to consider doing surgery under local anesthesia, as their surgeon. Unfortunately, the article contends that with basically a weekend course, perhaps over soft drinks, and in a 30-minute teaching seminar, one can learn everything you need to know to do this kind of surgery under local anesthesia. So I think safety is really not what's paramount for these doctors, and certainly not in the best interest of the patients.
So